Chronic Obstructive Pulmonary Disease and Asthma, brought to you by Oakland Community Health Network. This educational PowerPoint about asthma and COPD is part of the Oakland Community Integrated Healthcare Collaboration Project, which allows for individual organizations to determine staff training needs based on their position and job responsibilities, upward movement in terms of skill competency, and coordinated primary care needs of people with severe mental illness or intellectual and developmental disabilities. Almost 30% of the people that we work with have some type of asthma or COPD, and it's about 25% with asthma and 5 or 6% have COPD diagnosed. The objectives of this PowerPoint are to know more about COPD and asthma and how it affects individuals served, to discuss common medical tests and interventions used to diagnose and treat COPD and asthma, to discuss why individuals served are at high risk and how we can help, and how to identify risk factors. COPD, this is what it stands for. C, chronic, lasts more than 3 months. O is for obstructive, causing a blockage. P for pulmonary, related to the lungs. And D, disease, a disorder or incorrectly functioning organ, part, structure, or system of the body. COPD, or chronic obstructive pulmonary disorder, is a disease that makes it hard to breathe. It is a progressive disease, and the term COPD also includes two main conditions, emphysema and chronic bronchitis. Symptoms of COPD do not appear until 50 to 70% of lung function is gone. COPD can cause coughing, wheezing, and mucus that makes it very hard to breathe. Smoking cigarettes is the #1 cause of COPD. Other risk factors include inhaled pollution such as occupational, indoor, and outdoor, reduced lung development or severe lung infections during childhood, and coexistence of asthma. Some experts include lower socioeconomic status and poorer nutrition as risk factors. Genetic factors also are thought to influence COPD severity. Long-term exposure to air pollutants can cause COPD. Symptoms of COPD are shortness of breath, chronic cough, sputum, wheezing, easily fatigued, barrel chest, which means the chest looks like it's protruding more forward instead of sideways, and frequent bronchitis infections. Dyspnea. This means difficulty breathing or shortness of breath. Some of the psychophysiologic components are triggered by such factors as anxiety or fear. Something common with COPD is dyspnea or difficulty breathing. And persons with COPD fear the sensation of dyspnea that results from inefficient breathing. Therefore, they avoid exercise. As difficulty in their breathing progresses, they begin to abandon activities, leading to a downward spiral of disability. Ultimately, they suffer increasing dyspnea even at rest. Lung function test, FEV1. This means forced expiratory volume to forced vital capacity ratio. Different organizations may define each stage of COPD differently. However, most of their classifications are based on a lung function test known as the FEV1 test, which is a forced expiratory volume in 1 second. This test is expressed as a percentage and measures how much air can be forced out from the lungs in 1 second. Being able to breathe becomes more difficult in later stages of COPD. According to GOLD system, the criteria for each COPD stage are as follows: Stage 1, mild; Stage 2, moderate; Stage 3, severe, and Stage 4 is very severe. The Global Initiative for Chronic Obstructive Lung Disease is also known as GOLD, and they came up with the GOLD system. Stage 1 is mild COPD. A lung function test is equal to or greater than 80%. There will be some airflow limitation, and a couple symptoms might be chronic cough and excessive mucus. A person with this rarely seeks treatment due to not associating these symptoms with having COPD. Stage 2 is moderate COPD. A lung function test is between 50 and 79%. This can be with or without chronic symptoms, and this stage is when most people seek medical treatment. Their symptoms are more problematic. Stage 3 is severe COPD. A lung function test is between 30 to 49%. This can be with or without chronic symptoms. COPD exacerbation is common and evident. Now, once the disease has advanced to this stage, limitation of airflow significantly worsens, and there's shortness of breath. Stage 4 is very severe COPD. A lung function test is less than 30%. This is also known as end-stage COPD, and their quality of life is greatly impaired, and COPD exacerbations are life-threatening. Airflow limitation is severe, and chronic respiratory failure is often present at this stage. Respiratory failure could lead to complications with the heart, and COPD could be fatal. For self-management, for prevention of COPD, stop smoking, kicking the habit once and for all, is the single most effective way to slow the progression of lung function decline that occurs in COPD. Get regular exercise. Staying active helps people maintain weight, stay strong, and avoid the crippling effects of COPD. Eating healthy. Some patients with COPD require as much as 10 times the energy to breathe as other people. Therefore, they need more calories from healthy foods. Some more self-management ways to prevent COPD from getting worse. Avoid exposure to airway irritants. This applies to direct and indirect exposure to tobacco smoke, air pollution, and occupational exposure to dust and harsh chemicals. Following a COPD treatment plan. Treatment for COPD helps ease symptoms and allows people to live a higher quality of life. And calling the doctor if symptoms get worse. Recognizing signs and symptoms of COPD exacerbation and other complications of COPD is an important part of living with this disease. The United States Preventive Services Task Force engages in a 5A intervention approach to counseling people to quit smoking. Ask about their tobacco use. Advise them to quit through personalized messages. Assess their willingness to quit. Assist them with quitting, such as helping them take a class, sign up for a class, or use psychotherapy. Arrange for follow-up care and support. Brief behavioral counseling, less than even 10 minutes, and medication therapy are each effective alone, although they are most effective when used together. The United States Preventive Services Task Force also advises clinicians to ask all pregnant women, regardless of age, about tobacco use. Those who currently smoke should receive pregnancy-tailored counseling supplemented with self-help materials. There is no cure for COPD. The standard medical management is using inhalers, which are fast-acting, and steroid inhalers that are long-acting, using the combination of both of them. Medication management includes antibiotics such as azithromycin. Surgery for people who have low exercise capacity and whose COPD affects their upper portion of their lungs, that may be an option. And also an endobronchial valve could be implanted for the purpose of controlling airflow. And be wary of experimental treatments. Note that there is no information regarding stem cell therapy for treatment of COPD. To date, there have been no clinical studies to support the claims of the many websites claiming that stem cells can reverse the disease progression in COPD. 5 therapies for COPD: the flu shot, the pneumonia vaccine, aggressive management for patients who are hospitalized, lung volume reduction surgery if recommended, and long-term oxygen therapy. Staying up to date on vaccines and using oxygen when it's prescribed can help patients with COPD to live longer, while inhalers and exercise may help patients with COPD live happier. People with COPD are at an increased risk for getting pneumonia. Hand washing and vaccination is the most effective way to reduce pneumonia. Emphysema is a form of chronic obstructive pulmonary disease, or COPD, that involves damage to the alveoli or air sacs in the lungs, making it difficult to breathe. A doctor may suspect a person has emphysema if they have a chronic cough and difficulty catching their breath. Characteristics of emphysema include a person may be very thin with a barrel chest. They typically have little or no cough or expectoration. Breathing may be assisted by pursed lips and use of accessory respiratory muscles. And the accessory muscles would be like using their neck and their shoulders to help them breathe. Patients may adopt the tripod sitting position, and this is leaning forward with their hands on their knees to get more air. The chest may be hyperresonant and wheezing may be heard. Heart sounds are very distant, and their overall appearance is more like classic COPD exacerbation. This is a good example of tripod breathing. Patients with advanced lung disease, in this case COPD, will often assume a tripod position, which is leaning forward, their hands are on their knees, when breathing difficulties occur. This provides a position that optimizes respiratory mechanics. Pursed lip breathing. This is an exercise for people with COPD to help them strengthen their lungs. Pursed lip breathing is a strategy that involves lightly pursing the lips together during controlled exhalation. Uses of pursed lip breathing indications are: a breathing pattern often is adopted spontaneously by patients with COPD to deal with episodes of dyspnea. It improves ventilation. It releases trapped air in the lungs. It keeps the airways open longer and decreases the work of breathing. It prolongs exhalation to slow the breathing rate. It improves breathing patterns by moving old air out of the lungs and allowing for new air to enter the lungs. It relieves shortness of breath and causes general relaxation. This technique is good to use during a difficult part of any activity, such as climbing stairs, bending, or lifting. And how to do this: a person needs to relax their neck and shoulder muscles. Breathe in slowly through the nose for 2 counts. Just a normal breath will do, and then they purse their lips like they're blowing out a candle, and they count to 4 while they're blowing out, just gently and smoothly. This will calm their nerves and relieve shortness of breath. Nearly 9 million people were diagnosed with chronic bronchitis in 2012, according to the Centers for Disease Control and Prevention. Chronic bronchitis can occur in all ages and genders, but is more likely to affect those older than 45 and women. A persistent cough that just won't go away could be chronic bronchitis. Like emphysema, chronic bronchitis is among a group of lung diseases known as COPD. Unlike acute bronchitis, chronic bronchitis is irreversible. Diagnosed by a chest X-ray, pulmonary function test, arterial blood gases, and a complete blood count. Symptoms of chronic bronchitis may include: a person may be obese, a frequent cough and expectoration are typical, using accessory muscles when they breathe, such as using their neck and their shoulders. Coarse rhonchi and wheezing may be heard through the stethoscope when a doctor is listening to their lungs. They may have signs of right heart failure, such as edema and cyanosis. Edemas retaining fluids like in the legs and the arms even. And cyanosis is having like a bluish tinge color to their skin due to low oxygen levels. Other health problems from COPD may include more frequent lung infections, an increased risk of thinning bones known as osteoporosis, especially if using oral corticosteroids, long-acting inhalers, or oral steroids. If there's problems with weight, if they have chronic bronchitis as a main part of COPD, a person may need to lose weight. If a person has emphysema as the main problem, they may need to gain weight and muscle mass. Some other health problems affecting someone that has COPD could be heart failure, which affects the right side of the heart, known as cor pulmonale, a collapsed lung, which is a pneumothorax. COPD can damage the lung structure and allow air to leak into the chest cavity, and sleep problems because of not getting enough oxygen into the lungs. Early warning signs of a COPD exacerbation are noisy breathing, which is also known as wheezing. It could be a sign of mucus or pus blocking the airways. Irregular breathing, if someone's using their chest muscles to breathe instead of their diaphragm area, this may cause uneven rising and falling of the chest. A worsening cough, coughing more than usual. The cough could be dry. A yellow mucus could be produced, green or even bloody, and it gets worse when lying down. Some more early warning signs are being unable to sleep and not having an appetite, and it's best to take sleep time seriously. When the body is tired, it's more likely to get sick. Early morning headaches, a buildup of carbon dioxide in the blood causes headaches. Swollen ankles, legs, or a belly pain, these symptoms are related to the heart or lungs. Having a fever, that's a sign of infection. Changes in skin or nail color, a bluish tint around the lips and nails, seems blue or purple. The skin looks yellow or gray. This is late and a dangerous sign of worsening breathing. It's best to call 911 to get help. If the person can't talk or they're unable to get words out, this is a late and dangerous sign of worsening breathing. Call 911. Asthma is a chronic disease involving the airways and the lungs. These airways or bronchial tubes allow air to come in and out of the lungs. The exact cause of asthma isn't known. Researchers think genetic and environmental factors interact to cause asthma, most often early in life. With asthma, the airways are always inflamed. They become even more swollen, and the muscles around the airways can tighten when something triggers symptoms. This makes it difficult for air to move in and out of the lungs, causing symptoms such as coughing, wheezing, shortness of breath, and/or chest tightness. In the United States, more than 25 million people are known to have asthma. About 7 million of these people are children. The Allergy and Asthma Foundation rated Michigan the fourth challenging state to live in with asthma in 2015. Adults with diabetes were over twice as likely to have COPD than adults without this condition, 14.7% versus 7.2%. Adults who were ever diagnosed with any form of cardiovascular disease were 3.6 times more likely to have COPD than adults without cardiovascular disease. Adults who were ever told that they had cancer or arthritis were 2 to 3 times more likely to have had COPD than their non-disease counterparts. Populations experiencing the highest COPD prevalence are women, adults living in low-income households, or living with disabilities. Some more COPD statistics. About 4.7 million Americans had emphysema in 2011. More than 90% of cases involve people over age 45. According to the American Lung Association, chronic obstructive pulmonary disease is the third leading cause of death in the United States. COPD kills more than 5,000 Michigan residents a year. In 2011, an estimated 8% of Michigan residents reported a doctor has diagnosed them with COPD. Women are diagnosed with COPD more often than men. Among Michigan adults with current asthma, an estimated 28% had also been diagnosed with COPD, making adults with current asthma nearly 5 times more likely to have COPD than adults without asthma. The CDC reports annual financial cost of COPD to be $36 billion in the United States. An estimated 16.4 million days of work are lost due to COPD each year. Of the medical cost, 18% was paid for by private insurance, 51% by Medicare, and 25% by Medicaid. A CDC study projects a rise in medical costs from $32.1 billion in 2010 to $49 billion by 2020. The majority of COPD medical costs are related to healthcare visits, emergency department rooms, and hospitalizations for exacerbations. Current Psychiatry, a medical journal, reports that having a comorbid mental illness triples the mortality risk of a chronic lower respiratory disease like COPD. 6.3% of the U.S. population have COPD. Studies have found the prevalence of COPD is significantly higher among those with serious mental illness. In Oakland County, 11.4% of adults 18 years of age and older reported currently having asthma, and for children the number is 6.3% under 18. In Oakland County, there were 39 deaths from asthma between 2012 and 2014. The mortality rate of asthma is 6.9 per 1 million people. The mortality rate for asthma in Oakland County is similar to the state rate. There are about 1,594 hospitalizations each year in Oakland County for asthma. The rate of asthma hospitalization is 12.3 hospital stays per 10,000 people. The rate of asthma hospitalization is lower than the state rate. Asthma risk factors. Young children who often wheeze and have respiratory infections, as well as certain other risk factors, are at highest risk for developing asthma. The other risk factors include having allergies, eczema, which is an allergy skin condition, or parents who have asthma. There's a 49% non-genetic risk and a 51% genetic risk. Among children, more boys have asthma than girls, but among adults, more women have the disease than men. It's not clear whether or how sex and sex hormones play a role in causing asthma. Some people develop asthma because of contact with certain chemical irritants or industrial dust in the workplace. For asthma drug therapy, there are relievers that are short-acting, there are controllers that are long-acting, and there are preventers, and these are inhaled corticosteroids. The next several slides describe the different types of asthma. Exercise-induced asthma. This is the tightening of the muscles around the airways. It is distinct from other types of asthma because it only happens when a person exercises. Staying active is an important way to stay healthy, and asthma should not keep a person on the sidelines. A physician can help develop a management plan to keep the symptoms under control before, during, and after physical exercise. It can be prevented by taking a pre-exercise medication and by warming up or cooling down. About 10% of the general population without asthma have exercise-induced asthma when they exercise. People with a family history of allergies or asthma are more prone to developing asthma. Many people with asthma also have allergies, which is called allergic asthma. Occupational asthma is caused by inhaling fumes, gases, dust, or other potentially harmful substances while on the job. Childhood asthma impacts millions of children and their families. In fact, the majority of children who develop asthma do so before the age of 5. An allergy immunologist is the best qualified physician in diagnosing and treating asthma. Asthma symptoms may be shortness of breath, wheezing, chest tightness or pain, chronic coughing, trouble sleeping due to coughing or wheezing. Asthma symptoms, also called asthma flare-ups or asthma attacks, are often caused by allergies and exposure to allergens. Some of the asthma treatments include fast-acting inhalers, long-acting steroid inhalers, oral and intravenous corticosteroids that may be required for acute asthma flare-ups for severe symptoms, and a nebulizer changes liquid asthma medication into a mist so it can be easily inhaled into the lungs and can be prescribed for home use. Sometimes asthma symptoms are mild and go away on their own or after minimal treatment with asthma medicine. Other times, symptoms continue to get worse. Meter dose inhaler law. Michigan's public and non-public school children under certain conditions are allowed by law to carry and self-administer prescribed asthma and allergy medications on school grounds and during school-sponsored activities. This legislation ensures that students with asthma and allergies have immediate access to life-saving medications. The metered dose inhaler law specifically does the following. It permits a student to possess and use a metered dose inhaler or dry powder inhaler to alleviate asthma symptoms before exercise to prevent the onset of these symptoms at school or school-sponsored activities and programs. A student may also carry an epinephrine auto-injector or epinephrine inhaler to treat anaphylaxis. And in order for the student to possess and use their inhaler, the student must have written permission from his or her physician and parent, and the principal must have copies of both approvals. People with asthma are at risk of developing complications from respiratory infections, such as influenza and pneumonia. It is important for asthma sufferers, especially adults, to get vaccinated annually. An individual needs to seek an asthma specialist if special tests are needed to help diagnose asthma, if they had a life-threatening asthma attack, if they're on more than one kind of medicine or they need higher doses of medicine to control their asthma, or if they have overall problems getting the asthma well controlled. Also, if they're thinking about getting allergy treatments. Types of asthma tests. Spirometry. This is a common office test used to assess how well the lungs work by measuring how much air a person inhales, how much a person exhales, and how quickly a person exhales. This test is used to diagnose the severity of asthma and how well treatment is working for an individual. Bronchoprovocation. This test measures the sensitivity of the airways. Using spirometry, this test repeatedly measures lung function during physical activity or after receiving an increased dose of cold air or a special chemical to breathe in. Sleeping test. This is a test to show whether people have another condition with the same symptoms as asthma, such as reflux disease, vocal cord dysfunction, or sleep apnea. Chest X-ray and electrocardiogram. These tests will help determine whether a foreign object or other disease may be causing symptoms. Allergy testing. A drop of a suspected allergen is pricked on the surface of the skin. The test is performed on a person's back or forearm. If a person is allergic to one of the tests, there will be redness and swelling at the test spot. Skin tests are usually completed because they are rapid, reliable, and generally less expensive than blood tests, but either type of test can be used. Many people with asthma also have allergies, so a doctor may perform allergy testing. Treating the underlying allergic triggers for asthma will help people avoid asthma symptoms. Avoid asthma triggers. Indoor mold. Fix leaky faucets, pipes, and other sources of water that have mold around them. Clean moldy surfaces with bleach. For pollen and outdoor mold during allergy season, try to keep windows closed, stay indoors if possible from late morning to noon, and ask a primary care doctor to prescribe an allergy medication. For tobacco smoke, quit smoking and do not allow smoking in the house or car. For animal dander, if you have pets inside, try to keep pets out of the bedroom or sleeping areas at all times. If possible, keep away from fabric-covered furniture. Dust mites, encase pillows and mattresses in dust-proof covers. Reduce indoor humidity. Remove carpet from the bedroom. Keep stuffed animals out of the bed or wash them weekly in hot water. For cockroaches, keep food and garbage in closed containers and never leave food out, and spray to kill cockroaches or use traps. Smoke, strong odors, and sprays. Do not use a wood-burning stove, kerosene heater, or fireplace, and stay away from strong odors such as perfume, hairspray, and paints. When cleaning, vacuum at least once a week, stay out of recently vacuumed rooms for a short while afterwards, and use a dust mask when vacuuming or a vacuum with a HEPA filter. For cold air, cover the nose and mouth with a scarf on cold and windy days. After thunderstorms, emergency treatments for asthma dramatically increase. The most common explanation of this phenomenon is pollen grains rupture during an electrical storm, releasing airborne allergens, which are then spread by gusty winds from thunderstorm downdrafts to ultimately lead to an increase in the risk of asthma attacks in allergic individuals. Extreme emotional states like heavy laughter or intense crying can also prompt asthma attacks by changing breathing patterns and restricting airflow. Also, stress can trigger asthma symptoms. It is best to practice stress management. Food preservatives, food colorings, and flavoring agents have been found to cause asthma attacks in some people. Make sure to read labels. People with asthma need to carry their inhaler with them at all times. About 20% of adults with asthma are sensitive to and have symptoms when they take aspirin. Acid reflux and GERD both can cause pain and burning in the throat, particularly when lying down. They can also spark an asthma attack, even if heartburn is not noticeable. Drinking certain alcoholic beverages can worsen asthma symptoms and increase chances of an attack. People may be allergic to the alcohol itself or to ingredients added during processing. An asthma action plan is a written plan developed by a physician to help control a person's asthma condition. It describes daily treatment, such as what types of medicines to take and when to take them. This is an example of an asthma action plan for a person. It has a green zone, a yellow zone, and a red danger zone. Medications can be added to the list to help a person know what to use in the correct order if they're having a dangerous situation or just ongoing maintenance in the green zone. Here are some IPOS goal examples. For medical behavioral management or healthy behaviors, individual will follow the doctor-approved action plan for their condition. They will attend medical appointments. They will take medications as prescribed. For role management and modifying behaviors, individual will learn how to use the prescribed home medical equipment. Role management continued. Individual will start an exercise regimen. They will attend a smoking cessation class. And for healthy coping skills, the individual will ask questions about their disease and seek out resources, or they'll seek support if needed from their doctor, case manager, or therapist. There are some great applications out there for iPhones and Android phones. Some of them are My Strength, My Asthma Log, My Breathable mobile app. I'm sure there are others to choose from that people might find very helpful. My Strength is the health club for your mind. This is a website for anyone and it has helpful information that is educational, including specifics on mental health and ways to manage anxiety and stress. Please encourage everyone to sign up and use these resources. COPD Asthma Quiz. COPD stands for Chronic Obstructive Pulmonary Disease. True or false? Number 2. COPD includes two main conditions, emphysema and pneumonia. True or false? Number 3. Smoking is the #1 cause of COPD. True or false? Number 4. Spirometry is a common test used to diagnose asthma and COPD. True or false? Number 5. Tobacco smoke may trigger asthma. True or false? The quiz answers for number 1. COPD stands for Chronic Obstructive Pulmonary Disease. This is true. Number 2, COPD includes two main conditions, emphysema and pneumonia. This is false. It's chronic bronchitis, not pneumonia. So it's emphysema and chronic bronchitis. Number 3, smoking is the #1 cause of COPD. This is true. Number 4, spirometry is a common test used to diagnose asthma and COPD. This is true. Number 5, tobacco smoke may trigger asthma. This is true. Here are some contacts and resources. The Asthma and Allergy Foundation of America, the Michigan chapters in West Bloomfield, Michigan, U of M Michigan Medicine that has COPD and emphysema, it's in Ann Arbor, American Lung Association that's located in Madison Heights, Michigan, the COPD Foundation, their headquarters is in Miami, Florida. Some more contacts and resources. American Academy of Allergy, Asthma, and Immunology, that's in Milwaukee, Wisconsin. The National Heart, Lung, and Blood Institute in Bethesda, Maryland. Some web resources and links that are helpful. COPD Foundation, Golden Initiative for COPD, American Lung Association. Better Information, Better Health at webmd.com. The American Academy of Allergy, Asthma, and Immunology, and the National Heart, Lung, and Blood Institute. This concludes the presentation on asthma and COPD. We hope this was helpful in understanding asthma and COPD conditions. If there are any additional questions or concerns, please feel free to contact Susan or Nicole. This is the end of the COPD and asthma educational PowerPoint. Thank you for being a part of our Integrated Healthcare Initiative.